Time now to check in at the AMGA annual conference, where once again Andy Roesgen is on the scene.
No city in the world knows more about transformation and risk than Las Vegas. So what better place for the AMGA to face its own challenges while still trying to maintain its core values?
What we're saying is that everybody shares accountability for whole person care.
The enormous changes in healthcare delivery can seem both exhilarating and terrifying.
We've always been in a volume-based game. The sicker you are, the more money we make. Even if we mess up in the hospital, we'd make more money. And that's a perverse system. That system is finally evolving and shifting.
And with that comes an even bigger focus on patient populations.
Help them stay healthy as long as they can and not come and see us, and then be there for them when they need to see us, help them if they develop chronic diseases, manage it as best as they can.
So physicians have to take risk. If you are going to do that surgery, you're going to have the best outcome, and it was really needed with the least amount of expense involved to make sure that the highest value was delivered. I think the buzzword is volume to value, but whatever it may be, it's about getting paid to do the right thing finally, and the right thing is a healthier population.
AMGA members have come here from around the country, and their own top priorities are as unique as their hometowns.
Our challenge is, surprise, surprise, cost. And so how do you balance that high quality brand we have and yet compete on the mass market for cost? And I think that we're seeing those cost pressures.
We have so many different systems that we're working with on the outpatient side, and then with our laboratories and our radiology and then our inpatient, and none of them are talking to each other. And so we're trying to get a lot of online scheduling down and just make it a lot easier for the patients to come into the system from any different avenue.
Another big challenge for AMGA members is the head-spinning advancement in technology. For just about every aspect of healthcare delivery these days, it seems there's an app for that. Dr. Daniel Kraft delivered an eye-opening look at where it's all going.
The opportunity is that the future is somewhat here. You can use some of these wearable technologies, genomics, connected homes, big data, analytics today, but you need to plan for where it's likely going to be in 1 to 2 to 5 years.
When it comes to the enormous shift in value-based care, it's primary care doctors who are on the front lines. And Dr. Todd Staub wants to convince other doctors that the shift is good for them as well as their patients.
We made people come through the door for silly things, like when things were going well, you would come in and we'd look at your labs and say, everything's great, you're fine, see you later. That's not a good use of your time.
And Dr. Staub is trying to help other primary care doctors face the new realities of healthcare, just as these AMGA conferences have been helping him for years.
I have to say that AMGA has been instrumental in helping us navigate through this period of time and help us build a new culture about being a medical organization, being a coordinated system of care. The first meeting I came to, I remember, I just felt like I came home.
As for the future, AMGA hopes to get physicians on board with what once was unthinkable.
So getting all of those things right, getting it paid for, understanding how to do it the best way we can, and learning from each other is terrifying and exhilarating all at the same time. Because this is for me, you, for my parents, for my kids, for the whole population in the United States. And it's a great time to be in healthcare.
In Las Vegas, Nevada, I'm Andy Roesgen.